Connie Lowenstein tells the I-Team she was taking the antidepressant Wellbutrin XL, the extended release formula of the drug.
And then my insurance company insisted that because generics were available and much less expensive, that they wanted me to try the generic, which I did.
But Connie started having side effects from the generic called Budeprion.
And it was keeping me up at night. It was causing heart palpitations.
This is the People's Pharmacy.
The I-Team learned Connie is one of hundreds of people who contacted Joe Graydon on the radio show The People's Pharmacy on WUNC. They complained the generic Wellbutrin caused side effects they never had with the brand name drug.
I become irritable, I've had headaches, I've had digestive tract problems, my hand shakes, I've got a tremor, and I can't sleep very well. What's going on?
Graydon asked the FDA why it was happening.
And the FDA said, oh, don't worry. It's all psychosomatic. People see it's a different kind of pill. It's just in their heads.
But it was not in their head. The I-Team learned it was a problem in the bioequivalency of the generic and how quickly it released its active ingredients in the body. Dr. Todd Cooperman of ConsumerLab.com tested the 300 milligram dose of the generic.
What we found was shocking. The generic released its ingredient very quickly. So you're getting a burst of medication coming out very early on with the generic that you shouldn't be getting.
The I-Team traveled to FDA headquarters in Maryland to find out why it happened. Janet Woodcock, the director of drug evaluation and research, admitted the agency made a mistake. She told the I-Team the drug company tested lower doses of Budeprion XL, but did not test the 300 milligram dose because it was afraid volunteers might have seizures.
We had the company do the tests on the lower doses, and they were found to be bioequivalent. But we made an assumption that it would be also bioequivalent at the higher dose. And that assumption actually turned out to be incorrect.
As a result, the company that made Budeprion 300 XL, Impax, took the drug off the market.
What we learned from the Budeprion case was in the case of extended release products, we can't do this kind of extrapolation, and we will have to find ways to test them for bioequivalence.
The I-Team has learned the FDA is now taking a hard look at how it tests all extended release drugs. But we wanted to find out about other generics people have complained about to the FDA. The I-Team discovered the agency also has many reports about the extended release generic drug for Concerta called methylphenidate hydrochloride. The drug is used to treat people with ADHD. The FDA is concerned about the bioequivalence of two generic versions of Concerta made by Mallinckrodt and Kudco. But what about generic drugs in general? Are they as good as brand name drugs?
They must contain the same active ingredient at the same strength, and that has to be absorbed into the body at the same rate and extent as a brand name.
But the inactive ingredients or fillers are usually not the same.
They could sometimes have slightly different fillers in them, but we make sure that those fillers don't have any impact on the product.
Next time on The People's Pharmacy, we'll bring you up to date on the health stories.
Joe Graydon, the radio pharmacist, says if you're taking extended release generic drugs, you might not be getting what you think you're getting.
At the end of the day, they should be absolutely the same. In reality, they could be quite different.